This video will help you understand how EMDR works and whether it can help you. And at the end of this video, I will share the number one thing that you can do now to begin to recover from anxiety and trauma. I will also share with you the main thing therapists do to make sure that somebody is ready to move forward with EMDR processing. I have been working with EMDR for over a decade. I have been certified. And I've helped hundreds of people recover from anxiety and trauma. Now, EMDR therapy is actually a comprehensive therapy technique. It's not just the eye movement piece. That's the part that everybody pays attention to because it seems a little weird. But it's actually a comprehensive technique that incorporates cognitive behavioral therapy, it incorporates psychodynamic therapy, it brings in body-centered therapy. It's very holistic and it's very integrative. So for example, all trauma treatments and all phobia treatments incorporate an element of desensitization and an element of reprocessing. Now, desensitization sounds like, is what it sounds like. It is a process of desensitizing the person to the event, to the trauma, or to the thing that they are afraid of. And then once the person is desensitized and doesn't have as strong an emotional reaction to that thing or event, then the event can be reprocessed. The beliefs about the self and about the world can be changed and can be seen differently to help the person remember the event more adaptively and move forward more clearly in their life. And the regular process in therapy of talking over a trauma or talking about something very often does desensitize it, even without the EMDR. But in my experience, the bilateral stimulation that goes with EMDR speeds up that process in an incredible way. The bilateral stimulation portion of the EMDR process is what we call the active processing stage. And the person will sometimes watch the therapist's finger move. They'll move their eyes back and forth. I actually use a light bar in my office, and I will share with you what that looks like here. And you can also hold tappers that alternate a tap. You can have a headphone on that alternates sounds. But all of these techniques are stimulating both hemispheres of the brain, the left hemisphere and the right hemisphere. So the bilateral stimulation of the brain gets the whole brain working, both hemispheres, and it really helps to integrate the memory. So it integrates the emotional portion of the memory with the logical portions of the memory. It also helps the person connect with what they're feeling when they remember the memory, and then also the feeling of safety of being in a therapist's office. And this is very important to feel as safe as you can with the therapist you're doing this with, because you also will move in between being aware of, hey, I'm safe here, but I'm not feeling safe when I think about this. And moving in between those two things, again, is helping to process the emotions and process the memory. So I believe that EMDR helps to stimulate the brain's own natural ability to process information and to heal itself. So can EMDR help you? EMDR is highly, highly effective for post-traumatic stress disorder, single incident trauma, recent traumatic events, which would be acute stress disorder, phobias, all sorts of phobias, fear of flying, emetophobia, agoraphobia. It's highly effective for panic attacks, and it's also very effective for life transitions, for those times in life where your head and your heart might be in a different place and you can't quite sort through. It doesn't have to be something as severe as a traumatic event. So in those instances, EMDR is extremely effective. And then there are a number of other types of situations where EMDR can certainly help, although it will be a more extended course of treatment. And that would include complex post-traumatic stress disorder, extended childhood abuse, depression, particularly if there's a traumatic root to the depression, and dissociative disorders. So that gives you a sense of the kind of things that EMDR can help with. So the thing that every well-trained therapist will do prior to beginning active processing with a client is something called a safe place exercise. And this exercise assesses whether a client can access feelings of safety when they are safe. With EMDR, it is super important that the client have enough emotional regulation tools that they can do some emotional regulation in between sessions. So what I want to share with you right now, which is really the number one thing you can do to help recover from anxiety and trauma on your own, is for you to access feelings of safety on as regular a basis as you can. The key question is, can you feel safe when you are safe? So I have prepared for you a series of 3 guided visualizations, and I call these the mini-series. Being that sense of like, relaxation. And it is a mini-series of 3 guided visualizations that I do with my clients in my office, and I recommend that they practice them in between sessions. And these are some visualizations that you could do on a daily basis to help increase how often you allow your body to physiologically relax while you're alert and to feel safe when you are safe. You can access these visualizations for free, and I really, really hope that they are helpful for you. In the next couple of weeks, I will be releasing videos specifically on using EMDR with anxiety disorders and using EMDR with PTSD. So please subscribe and hit the bell so you're notified when my videos are released on Tuesdays. And if you found this video helpful, please comment below with the word helpful and any other comments you might have, and please share it with a friend who might benefit from it. And I look forward to the next time.